so many of you for attending this great, exciting announcement. My name is Dianne Doyle. I have the privilege to be President and CEO of Providence Health Care, and it will be my pleasure to be the MC for this morning's event. Before we begin, I would like to thank the Coast Salish First Nations for being the stewards of the land on which we are gathered today. We're extremely grateful for their stewardship. I want to thank all of our special guests who are present. They are too numerous to name, but all of you represent our partners and stakeholders: Provincial Health Service Authority, Vancouver Police Department, City of Vancouver, University of British Columbia, our donor community, our fabulous foundations, Tapestry Foundation and St. Paul's Hospital Foundation, and of course numerous staff and medical staff from Providence Health Care and St. Paul's Hospital. As you likely know by now, we're assembled here today to make a very important announcement about the future of St. Paul's Hospital and Providence Health Care. An announcement of this magnitude impacts so many stakeholders. So we have a number of speakers on the program today representing those stakeholders, including the most important, and that's our patient community. We're going to begin in a few seconds with our chair, Geoff Plant, who will make the announcement, and he'll be followed by Stephen Brown, the Deputy Minister from the Ministry of Health, and then we'll have some insights from other key speakers. In the interest of time, as those speakers come forward, I'll introduce them at that point. After those speakers present their perspectives, we're going to have a short technical briefing that will be done by two of our project leads, Neil McConnell and Darlene McKinnon. And we expect that technical briefing will likely result in a number of questions, both about the build itself and about what it means for the delivery of care to our communities. And we'll have several physicians joining Neil and Darlene at that point in time so that they can contribute to answering any of the questions that come forward. So with that context, it's my extreme pleasure and privilege to introduce the Chair of Providence Health Care, Geoff Plant.
Thank you, Dianne, for that introduction, and welcome everyone to this very important and special event and announcement. For the past 6 years, I've had the great pleasure to be a volunteer member of the Providence Health Care Board of Directors and to be chair for the past 5 years. With 16 sites in Vancouver, which include hospitals, community clinics, elder care residential, and complex care sites. And with partners like Vancouver Coastal Health and UBC, Providence is a dynamic, values-based organization with a storied tradition of compassionate service to British Columbians. It is especially an immense privilege for me to be part of a mission of healthcare that has such a great history and a global reputation as St. Paul's Hospital. From humble beginnings, we are now poised to help reimagine the future of healthcare to better meet the needs of British Columbians. It's my great pleasure, therefore, to announce today that the Ministry of Health and Providence Health Care are renewing St. Paul's as a brand new hospital and integrated healthcare campus built from the ground up on our Station Street site. It is a plan for redevelopment that, most importantly, puts the patient at the center of care and offers a unique and forward-looking solution that has two main components. First, the core of the transformation is a completely new St. Paul's Hospital as a hub of world-class integrated care, research, and teaching center, providing major critical care and acute services. The new hospital will continue as one of British Columbia's two highly specialized care hospitals for adults. It will also be at the center of a network of new and existing dedicated primary care clinics in the region, including one that will be set up in the West End of Vancouver. Second, this hospital complex will be integrated on-site at Station Street with a health campus of community and primary care services to serve the most vulnerable patients. That site could include many different solutions. This new St. Paul's will be a catalyst for helping realize the Ministry of Health's strategic vision of improving primary, community, and residential care while investing in services for those with moderate to severe mental illnesses, addictions, dementia, and chronic care concerns. While our acute care system does an excellent job of caring for people when they are very sick, we need to shift our planning priorities into caring for people before they reach that stage of illness. This redevelopment will strengthen and integrate every patient's care path. The new St. Paul's will give patients a 24/7 center to go to that will have a centralized intake process. It will determine which patients require hospital care and which require primary, community, or other specialist care or supports. Patients will be directed onto the right care paths quickly and efficiently, resulting in less congestion, faster and better treatment, and better use of taxpayer dollars. All patients that are treated in our center will have focused care plans supported by dedicated care teams. Our plan is to further build on St. Paul's current provincial leadership role and proven reputation in key areas, including heart, lung, kidneys, and HIV/AIDS, by strengthening existing networks and building centers of excellence in addictions, mental health, aging, and seniors care. Although a majority of the patients that are admitted to St. Paul's come from outside of Vancouver and from throughout the province, we know the hospital is cherished by the community that it's been in for over 100 years. So the redevelopment planning will therefore include consultation on the continuation of key primary health services either at the existing St. Paul's site or in the West End. We will look at what services West End residents use most from St. Paul's Hospital, and we will work with the neighborhood and with healthcare partners to determine which services need to remain in the West End. We will begin a business plan development process and comprehensive consultation activities to engage with all stakeholders. I assure you we are going to hit the ground running with this announcement and this plan. The Ministry of Health will provide $500 million, and Providence Health Care will contribute the rest of the cost. It will be non-taxpayer money, leveraged from Providence's land assets and through the donor and philanthropic community to be further determined by the business planning process. Over the years, we have been on several planning paths for St. Paul's. The good news is we learned from all of them, and we have learned from each new redevelopment vision planning, and they have all contributed to the plan we are laying out today. Although the last concept plan had some great ambulatory care solutions, with an estimated cost of $850 million, it fell short on a number of fronts. A solution at the Burrard site would have been inefficient, both economically and from a care design perspective, because upgrades would have had to be done piecemeal over many, many years. As well, seismically upgrading the site and all other construction would have had to occur while the hospital continued to operate, and the disruption to patient care and the neighborhood would have been a major challenge. The proposal to build the new St. Paul's has a number of advantages. The Station Street site, for example, has 18.5 acres compared to the 6.5 acres at the current site. The ability to design a hospital from scratch, a hospital of the future that best addresses patient needs, is greatly improved at this site. With a new hospital, patients will be able to benefit from having a much higher percentage of single patient rooms. Single patient rooms mean better privacy for patients, safety from infections, improved lengths of stay, and better care outcomes. The ability to have future expansions and to have an integrated primary and community care campus are only possible at the Station Street site. More will be said about these concepts in a few minutes as part of the technical briefing. But at the heart of all of this is the patient, the real people who feel at their most vulnerable when having a health crisis or needing medical intervention. Modern, highly functional care settings are enablers to excellent care. And that's why we look forward to having a new state-of-the-art facility, so our amazing care staff can finally have the means to deliver even better care. The bottom line is that what we will build at the new site is a much bigger vision with a broader range of services than what would have been built at St. Paul's Hospital in Burrard. In addition to a fully equipped state-of-the-art acute care services, we will be expanding access to community care, looking to add new mental health beds, residential care beds, 24/7 primary care, chronic disease management services, a birthing site, all with the goal of putting the patient first. Providence looks forward to working closely with health providers, with Vancouver Coastal Health, Provincial Health Services Authority, UBC, with patient representatives, with the City of Vancouver, the community in which we operate, with the government, with the donor community, and with our health and academic partners from throughout BC to design our care solutions. Only through such an approach will we be able to successfully transform St. Paul's to deliver the best patient care. Thank you.
Thank you, Geoff, not just for the announcement that you've made today, but for your leadership in helping us get to this point in our history and evolution. So although the announcement seems like it's been a long time coming, it really does represent great news to the thousands of patients that we serve and the providers who bring their dedication and expertise to provide that care. The Sisters of Providence founded St. Paul's Hospital 120 years ago. They were courageous, innovative, and always pushed the boundaries to find solutions to meet the needs of those we serve, and in particular, those who are the most destitute, vulnerable in our communities. So the vision of Renewal that you've just heard from Geoff is symbolic of that same innovation the sisters demonstrated and which our staff continue to live each day at Providence Health Care in St. Paul's. So it's my pleasure now to introduce our key partner in this redevelopment from the Ministry of Health. So welcome to Deputy Minister Stephen Brown.
Thanks, Dianne, and good morning to everybody. I'm really pleased to be here this morning on behalf of Health Minister Terry Lake to talk about government's role and support for the new and revitalised St. Paul's. In the fall, Providence Health Care approached the Ministry to take another look at the plan to redevelop St. Paul's and to reconsider the possibilities that Station Street had to offer. Over the past 4 months, the Ministry has been working closely and collaboratively with Providence Health Care to explore this idea of a new and better St. Paul's Hospital that revitalises both the hospital and improves the overall care provided. Key to this collaboration was to ensure that any new option would better meet the changing health needs of both downtown Vancouver but also those of the Lower Mainland and the broader province. A new option for St. Paul's had to fully align with the Ministry's new vision of a more patient-centred, fully integrated healthcare system that over the coming decades will need to better manage chronic diseases, both in the community and in acute care settings. That system will also need to better support and care for our frail elderly population and provide more effective and responsive care for patients with mental health and addiction needs. From the initial discussions 4 months ago, Providence has collaborated closely with the Ministry to shape a vision for St. Paul's that will meet these needs. A vision that will be aligned with Providence Health Care's mission. Its mission is to provide compassionate and exceptional care for key patient populations, including seniors and those with challenging mental illnesses and addictions, while at the same time continuing to develop its important role providing emergency and critical care, as well as acute care services, including cardiac, renal, specialized and complex surgical services. The center of this transformation is a completely new St. Paul's that will be a hub of world-class integrated care, research and teaching. The campus will have new facilities that provide core critical care, emergency room and acute care services, as well as specialized dedicated mental health beds and services, and medical beds focused on providing optimal care for the senior community, as well as maternity care and end of life. This new facility will be much more than a hospital. This complex will be connected to a range of community and primary care services through a network of clinics affiliated or operated by Providence Health Care and linked to the St. Paul's campus. As this project is developed and the new hospital is built, this network will ensure that patients receive the best possible care where they live. St. Paul's Hospital will also continue to be an important part of the network of hospitals across the Lower Mainland, serving both Vancouver, the region, and across to the broader province. In conclusion, the new St. Paul's campus will be a catalyst for bringing to life a vision of patient-centered, acute, ambulatory, primary, and community care. This vision for St. Paul's fully aligns and moves forward the ministry's vision of improving acute and primary and community care with residential care, while increasingly investing in those services that will better meet the needs of the frail population, those with moderate to severe mental illnesses, those with dementia and chronic care illnesses. St. Paul's at Station Street will revitalise the system of care delivery, providing the latest and best care in the right place at the right time. It is the Ministry's expectation and belief that, along with Providence Health Care, that this facility will be something that the local community and the entire province will be proud of in the years to come. Thank you.
Thank you, Stephen. And on behalf of all of us at Providence and St. Paul's, I really want to thank you for your leadership and the vision that you've brought forward. You've been challenging all of us in the healthcare system, the health authorities in Providence, to really look at new ways to bring forward the kind of care that our customers, our clients, our patients need now and into the future. So we thank you for that. So our redevelopment vision emanates from the Ministry of Health's stated priorities for transforming BC's healthcare system into one that is truly patient-centered. We're confident we're meeting that challenge head-on, and we look forward to making that vision real through this redevelopment. Now it's my great privilege to ask Dr. Julio Montaner, Director of the BC Centre for Excellence in HIV and AIDS, to the podium. Julio needs no introduction. His list of accomplishments are phenomenal. His work in preventing and treating HIV/AIDS are known throughout the world. His awards and recognitions, the latest of which has been his being named as Officer to the Order of Canada, would take too long to list. Suffice it to say that St. Paul's and indeed all of British Columbia are fortunate to have Dr. Montaner's visionary leadership and his advocacy for helping stamp out HIV/AIDS in the province, and indeed having profound impacts on the battle against HIV around the world. I welcome you to the podium today, and there's something else special about today because it's actually Julio's birthday. So happy birthday to Julio.
Thank you, Diane, and thank you all for being here. I turned 45 today, as you know, and nothing could be better than being here to celebrate my birthday with the birth of the new hospital. Thank you, Stephen, for the announcement. Thank you, Geoff. This is really terrific. As I was thinking about the announcement, I I remember arriving to Vancouver in 1981 to do my postdoctoral fellowship in St. Paul's. And from the first day that I arrived, the talk of the town was the renewal of St. Paul's. And it looks like this theme won't go away. But finally, I'm confident that we now have a renewal. We have a new vision. Is totally in keeping with the strategic vision of the ministry and is really moving us into a much better and forward direction. I had the pleasure of meeting with the Premier and the Minister, Minister Lake, as well as Stephen last week on a number of issues. But at the end of the meeting, the Premier herself indicated to me how strongly committed she is to this new vision and this new venture that we are embarking today. I am extremely pleased to be moving forward at this time, and I'm really looking forward to the planning phase that will ensue over the next year, which give us the details of how this is going to unfold. So happy birthday to you all, and happy birthday to St. Paul's. Thanks.
I've known Julio since he arrived in the early 80s when we were both working at St. Paul's, and this horrible disease that we now know to be HIV and AIDS was first hitting the city. So we're indebted to you, as are all of those whose lives you've impacted by the work you've done around HIV and AIDS. It's my pleasure to have joined you and have you part of the announcement today because of that history we share. So another part of the care that we provide at Providence Health Care is all of those thousands of people we see daily through our emergency departments. And so it's now my privilege to welcome to the podium Dr. Dianne Kalla, who is the head of emergency services here at Providence Health Care. Welcome, Dan.
I'm actually extremely proud to have been part of the St. Paul's Providence Health Care family for the past 17 years. And I use the word family because that's what it's always felt like to me. Literally, I was born here at St. Paul's, and both my parents were on staff there. But there's an incredible family feel to the place that only those of us who work there can understand. Unfortunately, our emergency department, like many others in the province, has been facing increasing pressure in the form of soaring volumes and clients with increasingly complex healthcare issues. We require not only a better, more functional space, but we also need to find ways to manage our patients in alternate settings. And this new campus of health will provide us both those solutions. Our current hospital has been renovated and to a degree jury-rigged over the years into its current, I would call, labyrinthine structure at times. It's not conducive always to patient care or flow. As an example, the radiology department is located the equivalent of 2 city blocks away from the emergency department, and there's no renovation that will address that incongruity. Furthermore, our experience with SARS, H1N1, and most recently the Ebola scare has taught us the importance of proper isolation space to protect patients, staff, and family alike. While we've improved the layout and maximized our current space, it still won't likely be sufficient to deal with the next contagion or the next epidemic. But it's really exciting to think that not only will the new hospital be more accessible and more functional, but it'll offer us the opportunity to better align our emergency department with our community and primary care partners, both physically and philosophically, to link patients to adjacent community resources and care teams, to provide better continuity of care, and hopefully to keep our clients out of our acute care hospital for longer periods of time while they enjoy better quality of life. It's not the current hospital, the building anyway, iconic and outdated as it may be, or even the location that makes St. Paul's unique. It's the culture, the spirit, and most importantly, the people, the staff and patients, the St. Paul's family that makes it so special. I'm enthused about the opportunity to offer the same compassionate patient care-centered care to all of our clientele, particularly the vulnerable, the disenfranchised, and the frail elderly, in a physical plant designed up to 21st century standards that will provide a safer, more comfortable, and more dignified space for caring for our patients. Thank you.
I'd now like to welcome a representative from our patient community, Mr. Rob Nutter. Rob's a double transplant recipient. He received both a heart transplant and a kidney transplant at St. Paul's Hospital, and our wonderful team continues to provide care to him. He represents an inspiring example of how modern medicine And the exceptional people that deliver it can have profound impacts on the lives of people, and impacts that St. Paul's Hospital has daily on those that we serve in British Columbia. So welcome, Rob.
Hello. St. Paul's Hospital saved my life. First, in 2012, they implanted me with a left ventricle assist device. After a 5-month stint in the hospital, they finally got me home. They called me back a year later and implanted me with a brand new heart and kidney, which is functioning very well. And I'm currently receiving follow-up treatments every 2 months to make sure my new organs are working fine, and which they are. And I'm so happy for St. Paul's. They're so deserving of a new hospital. This is going to be good for all British Columbians, because all the people I meet there mostly are from all over the province, and it's like top-notch. Like Dr. Calla said, it's a family there. They treated me so well during my illness, and they are so deserving of a new world-class hospital, because they are world-class people that work there. Thank you.
Thanks, Rob, for reminding us about our mission and that we are here to serve others in need. A key partner for Providence Health Care is Vancouver Coastal Health, the regional health authority. So we operate, plan, and deliver our services in an integrated manner with Vancouver Coastal Health, and we'll continue to collaborate with them in all aspects of bringing this new approach to care and the redevelopment forward. So it's my pleasure now to welcome Mr. Kip Woodward, who's the chair of Vancouver Coastal Health.
Thanks, Dianne. Well, it's certainly an honor to represent Vancouver Coastal Health at this very historic announcement. Although I'm here as chair of Coastal Health, I'm also proud to be here as a former chair of Providence Health Care, which means I know firsthand just how important the development of a new St. Paul's Hospital is for the people of not only Vancouver, but for all of British Columbia. As some of you know, today's news is a culmination of over 2 decades of work and commitment to create a lasting legacy for Providence Health Care and for St. Paul's. Many of those people that have started this journey over 20 years ago are still in this room here today. The hospital, at St. Paul's Hospital, and it goes beyond just a local community hospital. While St. Paul's is located in Vancouver's West End, it is not just a West End hospital. St. Paul's is one of British Columbia's most significant health facilities. It's also an integral part of the larger regional framework of health services provided by Vancouver Coastal Health. Clinical services at Vancouver General Hospital and St. Paul's are closely aligned, sharing many resources and skilled expertise. The opportunity to develop those linkages even further with a new state-of-the-art facility is exciting for all of us and can only result in even more benefits to the patients that we serve. Over these past few years, Vancouver Coastal Health has also been building an integrated primary and community care network that is taking services out of traditional hospital and institutional settings and placing them closer to where people actually need them, in their home communities. Having that framework in place is integral to the new St. Paul's, because what we will see is a hospital built around the needs rather than tradition. As Geoff pointed out earlier, the St. Paul's at Station Street will be more than an acute care hospital. That is why we're having a strong and robust primary care network in place is so essential to its success. Healthcare should not be about how many beds there are. It should be about the patients, the clients and residents who need our services, and a system to keep them out of hospital and as healthy as possible. Not only are we seeing fewer people going to our emergency rooms as a result of primary care, we hope that in years to come, there will be less dependence on hospital beds altogether. The approach of a 24/7 centralized intake process at the new St. Paul's that Geoff described earlier is a positive step in that direction, and one to be commended and look forward to. As a key partner, Vancouver Coastal Health is excited to work with Providence Health Care and the Ministry of Health on developing the new state-of-the-art hospital. We also want to thank the very many volunteers and generous donors who have supported this concept over these many years. It is thanks to their dedication, their vision, and their commitment that we are here today. Those individuals, the groups and organizations, understood the value of St. Paul's Hospital and a legacy that goes far beyond just its location. Its value as a leader in healthcare services and innovation for all of BC, and its value is one that we value and share at Vancouver Coastal Health. To everyone involved with moving St. Paul's to this next step, I say a huge thanks. And on behalf of Vancouver Coastal Health, we look forward to being part of the exciting new chapter in our healthcare for British Columbia. Thanks very much.
Thank you, Kip. We do appreciate your ongoing leadership and support. We're now going to move into the technical briefing component, so I'd like to introduce Neil McConnell, the project lead, and Darlene McKinnon, the Chief Clinical Planning Officer. They're going to provide some details. We'd encourage you to listen to the short presentation and then ask your questions after that. I'm also going to call forward, as they're doing the presentation, a number of our physicians who will be able at the end of the presentation to assist with answering questions. So if I can call forward Drs. Evan Wood, our Program Medical Director for Addictions, Julio Montaner, back to the stage as our Director for the Center for Excellence in HIV, Dr. Nardia Stridham, the Head of our Family and Community Medicine, Dan Calla, Head of Emergency Services, Bill McEwen, Department Head for Psychiatry, and Don Sin, our Respiratory Division Head and world-renowned Research Chair in COPD here at St. Paul's. So at the end of the presentation, myself, Geoff Plant, Kip Woodward, and Stephen Brown will also be here to help address any questions. So over to you, Neil. Thanks.
Thank you very much. Thank you, Dianne. I think we'd like to start by sharing some information about our patients, where they come from, and just give you a better understanding of St. Paul's importance, I guess, in the whole province of British Columbia, too. So Darlene will take us through some of that.
Okay. Hi there. Thank you. This slide shows us that 34% of our inpatients come from our local health area, but over 60% of the patients that we serve, inpatient at St. Paul's, come from across Vancouver Coastal, from Fraser Health, and across British Columbia. And it speaks to the tertiary and quaternary services that we provide, the teaching and research, and really this specialty care that Providence Health Care provides. If we're looking for clinic visits, and Dawn might be able to speak to this, but 50% of the patients we serve in our outpatient clinics or our ambulatory clinics are from our local health area. And 50% are from across the province. So primarily that's across the Lower Mainland, but also from across British Columbia. I don't know if Dawn wants to speak to the specialty services, or we'll speak to it later. If we talk to emergency, a bit higher, so about approximately 70% of the patients that we serve in our emergency are from our local health areas. But again, we're serving patients from across Vancouver Coastal, the Lower Mainland, and across the province. This slide is really talking about how patients arrive to our emergency and what percentage of those patients we admit. So approximately 25% of the patients we see at St. Paul's Hospital Emerge come by ambulance, and the rest are walk-in patients. And of all the patients who come, 11% of the patients are admitted. And this just looks at the patients who come by ambulance to St. Paul's Hospital Emergency, where those patients are coming from. And primarily those patients are coming from the downtown east side. They're coming from the West End and from the city centre. This is you, Neil.
Thank you, Darlene. I know there'll be questions later on, and we'll have the whole team will be here to be able to talk about these. Now, we're a long way from talking about buildings. As you obviously realize from the conversation, we have clinical planning work to do that is very, very important in the beginning. And I think one thing I should state, though, is this is an academic health sciences campus. This is not just a hospital with other buildings. This is an academic health sciences campus with more and more opportunity for research as time goes on. Although it's far too early to talk about buildings, we do know from the conversations that we've had that this project is something around 1 million square feet. And if we look at 1 million square feet on our 18-acre site, it probably looks something like this. And these are the elements, in part, that will provide that space to us. We will have a core hospital. We will have approximately 300 beds in there. all of the work still to be done on determining exactly numbers of beds and so forth. But approximately 300 beds there, approximately 250 of beds which are not core hospital beds, dealing with seniors, as the Deputy Minister talked about earlier. We will have space on the site for future development. We will have research and teaching integrated throughout the whole campus, but in addition to that, we will have a separate research capability on the site. And of course, built into that as well, we will have all of our ambulatory care clinics, day surgeries, etc., and all of the supports that one would expect in a future state-of-the-art core clinical hospital. We'll move on to the next slide. Thank you. So this is a slide just to identify the location of Station Street for everyone relative to the other hospitals in the downtown Vancouver area. And these community clinics are the Vancouver Coastal Health Community Clinics that Kip Woodward referred to earlier. And we will hope, as we move forward, we'll have a greater integration with all of these clinics, as well as some of our own primary care clinics that Dr. Snydrum will talk about as part of the question and answer process later on. You can see from here that Station Street is not far from either of our sites, Mount St. Joseph's and or Burrard Street. Thank you. Next slide. Okay. So this is a little fly-through of the 2006 plan that we have. And this was replicating St. Paul's, which is entirely different from the concept we have today following through in the Ministry of Health's concept for delivering health care in the future. But you can see here's the site coming up in a minute. And it is indeed a new way of delivering care that we're talking about. But at this point in time, in 2006, it was replicate St. Paul's, tying it into the local community, providing care in a way that enabled patients to have shorter lengths of stay, be treated appropriately in the facilities, and still have a set of buildings that would be significant part of the downtown core. All of this work remains to be done. We have to have significant conversations with the City of Vancouver and with all of the neighborhoods and constituents that make up part of this wonderful city. Thank you very much.